Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everybody. I'm Sarah Naimi from Bahrain Free Labor Unions Federation. I would like to greet you and thank you for attending this lecture. Usually we do different kind of lectures for health of our employees that falls all under the Bapcos and all the federation unions. And I would like to thank also Bapco Upstream Company and the Bapco Upstream Free Labor Union for organizing this in a collaboration with the Federation, in extension with the Bahrain Specialist Hospital, to provide this lecture for you all to take care of your health. I would like to call Dr. Mohammed Slil to the floor. He will be presenting the doctor and then we can carry forward.
Today we have our specialist, Dr. Jekir Hussein Shah, from Bahrain Specialist. He's specialized in pulmonary and intensive care unit and sleep. نرحب فيكم اليوم في المحاضرة هذه بحضور الدكتور جكير حسين، وهو متخصص في الأمراض الصدرية والنوم والعناية المركزة. Today the lecture will be about the lung cancer in the memory of the Lung Cancer Day. المحاضرة بتكون عن أمراض سرطان الرئة، وهو بمناسبة اليوم العالمي لسرطان الرئة. طبعا we have one thing about, I just want to brief something which is quickly, يعني all the scientists has been disagreeing on many things, and there are so many times you see things changing. We say, oh, this is raising cholesterol, egg is not. There is a lot of debate about so many issues, but there is one issue that the scientists has never been disputed about, is that smoking. So smoking, it is an associated factor for lung cancer. There is no dispute about it for many years. So now what happened now, the smokers started using alternative, which is vaping. And they are under impression that vaping it's not harmful as cigarette, which is actually now it's been proven to be not. It is harmful. So vaping is not an alternative risk. We have to study it. So most welcome, Dr. Hussein.
Thank you, Bapco Upstream, for giving me this opportunity. Today we are going to discuss about some basic awareness about the lung cancer and about the smoking cessation, what are the side effects from the smoking and all those in detail. Ladies and gentlemen, I am Dr. Zakir Hussain. I am pulmonologist and ICU specialist in Bahrain Specialist Hospital. On February, all over the world, we observe World Cancer Day to increase the awareness about the cancer and other things. And especially in August, we deal only with lung cancer. So, because lung cancer is still the third most common cause of death all over the world. So, you should be very careful. And despite so much of advances in medicine and so much of advances in treatment, still lung cancer is significant challenge for the healthcare. You know, in 2020, 1.8 million people died from lung cancer alone, and among them 2.2 million new cases were also reported in 2020. So it is rising every year. So only cause for, what are the risk factors for lung cancer? The first common preventable risk factor is smoking. Smoking tobacco, all form of tobacco, all form of nicotine is still dangerous for the lungs. So smoking tobacco is the first common risk factor for developing lung cancer. Always remember, whatever you do in your 20s, 30s, 40s and 50s, you have to pay back in your 60s. It never goes beyond that. And second-hand smoking is also important risk factor for lung cancers. A lot of females in the house, they get exposed to their husbands. A lot of kids, they get exposed to their parents. When they smoke in the car, when they smoke in the house, they get exposed to this second-hand smoking, will further worsen their risk factors for asthma, allergic diseases, and also lung cancer in the long run. Okay? Always be careful in what you do in your younger years, because you have to pay back. We always ask the patient how many years of smoking history in your entire life and how many number of cigarettes you smoke in those years. That matters. Even if you quit 20 years, still there are some changes that happens in the body. Always remember, if you quit smoking in your 30s, there is almost 80% reversibility of the side effects. If you quit smoking in 40s, there will be only 50% reversibility. In your 50s, hardly 40% or 30%. After 60, we tell them to continue smoking. There is no point in quitting at this age. So always make sure quit early when you are healthy. Okay. Again, another risk factors will be certain occupational exposure to the asbestos factories and certain chemicals like radon gases which are seen in certain houses, and cadmium exposure and exposure to arsenic, cadmium and nickel, and then certain fumes, all are risk factors for developing lung cancer. And family history is very important. If somebody has any family history of lung cancer, so they should be careful in their next generation. They should do early screening. That's very important. And certain lung diseases, like somebody already have lung fibrosis, like chronic lung diseases, like a smoking-related asthma, we call COPD, and lung fibrosis, we call in Arabic talaif, the lung fibrosis. These patients are prone to get lung cancers more compared to other people. As you tend to age, there are still, without smoking also, people do develop some cancers, and lung cancer also among them one. What are the signs and symptoms? How the patients present early in the hospitals with the lung cancers? See, the person, for other people it is easy to diagnose because they have the cough that stays for longer time. 1 month cough, immediately you have to approach doctor. Any person who is coughing for 2 weeks non-stop after a flu infection, there should be one chest X-ray to be done. Don't ignore cough. The problem with the smokers is they have this chronic smoker's cough early morning. As soon as they brush, they cough to clear the bulgum. So they try to ignore, even they have the worsening of the cough. They think it's a smoker's routine cough. But unfortunately, sometimes there will be hidden lung cancer in the lungs. So for non-smokers, it's easy. If they are coughing for 1 month, they immediately go to the doctor and they do the evaluation of X-ray and all those things. We can find something. And some people do have the infection, non-resolving pneumonia, we call that. The infection stays in the lung for longer time. Then we suspect lung cancer based on the clinical history. And chest pain, it comes little later. At that time, it's already too late. And coughing of blood also is too late. When they cough of blood with the lung cancer, that means it has eroded the blood vessel. It has spread little bigger. So that is all goes into next level. And any patient with any cancer in the body, they first have loss of appetite. Their appetite will be less. They don't like to eat food. And second thing, with the loss of appetite, they go into weight loss. Unexplained weight loss for any person, especially for the smokers or people who work in industrial area, always should be evaluated medically. And hoarseness of voice, the change in voice tone, is one of the commonest risk factor of lung cancer. If somebody has that one, that means already the cancer has spread to the vocal cord area because of the nerve is involved. So it has gone to next level. And shortness of breath, if somebody has the water in the lungs because of the terminal cancer, they will get breathlessness. And fingertips and what their fingers will change. I will show how it will be in the next slides. The physical examination is very important from the doctor's side to see this one. First, we see any smoker with the club fingers, the nails will become little swollen. If the nails are becoming swollen, then for the smokers, we always suspect lung cancer as the first cause. For other, there are multiple reasons for getting these club fingers. Even for the heart diseases or any oxygen drop in the body, they have swelling of the nails. Nails are important thing to diagnose what is going on in your body. This is another entity we call superior vena cava syndrome. This is somebody who is having flushed faces, or when they go into suju while praying, they get breathlessness. Then we have to do CT scan or to do evaluation. This is the next level of lung cancer. This is how it looks in the in the X-rays. You can see here, there's a white patch that comes in the lung. Usually some people suspect it's a pneumonia or infection, but some cases it looks like a cancer classically. This is like a ball's appearance, we call cannonball appearance. This is already the cancer has spread from other organs to the lungs. This multiple cancer cells will be there. These are like a stage 4 diseases, we call that. This is how the lung cancer look, the white thing. this is the PET CT. If we see any cancer in the CT scan, next we order PET CT scan that will tell us where is the cancer in the body and it has spread to other organs or not. You can see here in the bones, there's a red spot here, we call hot spot here. So these are how we decide what stage of cancer the patient has in the body. The common side of spreading from the lungs are it goes to the bones, it goes to the liver, it goes to the brain, it goes to the lymph nodes and also to kidney area. These are the common sites from where the lung cancer spreads to other organs. And certain, even from other organs also, it spreads to lung. It's very common to have lung metastasis from bladder cancer, and from lung cancer it goes to opposite lung, and ovarian cancer, main colon cancer, all these cancers spread to lungs also. Once we diagnose lung cancer, we have to get the tissue. That is important. So we go with a CT guided biopsy or bronchoscopic guided biopsy. We take a chunk of tissue, we send for histopathology. This is how it's scary it looks in lung cancer in the histopathology. These are the types of stages of lung cancer. The first stage is, you can see only one small dot here. This is the lung cancer. As a stage, when you start ignoring it, it goes spread to other organs. Then it spreads to opposite organ, and also it goes into beyond other cells. Then the stage 4 cancer is when it goes to other organs below the diaphragm, to the liver, kidney, or brain. Those things. Stage 4 lung cancer means already it's time over. Its maximum life, we call it 6 months after in stage 4. Unfortunately, for the lung cancer, the symptoms will not be that much. So early stage lung cancer is curable, but patients don't have much symptoms during the initial phases. Unfortunately, for the smokers, they have the cough only. They think that is a normal routine cough, and they land very late to the hospital. Till the time they come to the hospital, it is too late. And early low-dose CT scan is very important in diagnosing this cancer. This is a low-dose CT scan. We say, who are the candidates for going for screening, lung cancer screening? Elderly people from 50 to 80 year age who has the history of 20 pack years smoking. Pack year means somebody who smoked 1 pack of cigarette per day for 1 year, we call 1 pack year. Somebody who smoked 2 packs in a day for 1 year, we call 2 pack year. So anybody who crossed more than 20 pack year, means who smoke 1 pack for 20 years or who smoke 2 packs for 10 years, they are at risk for developing lung diseases, either cancer or there's a high risk of developing smoking related asthma. So these all increases when you cross the history of 20 pack year. So elderly people 50 to 80 who had a strong family, strong smoking history of 20 pack year, or who are current smokers or who quit smoking last 10 years to 15 years, we had to screen them for up to age of 15 years from 50 to see for cancer. After 80, they don't suggest to go for screening because it is routinely at the age it will be there. So it's very less dose and it's very easy to do the CT scan and no side effects of radiation. A lot of people I do see, they say, I did X-ray in other hospital. Within 5 days, you want to repeat an X-ray, it's a radiation and all those things. And they come up with a cup of coffee. We tell them the side effects from repeating X-ray is less than drinking 1 cup of coffee. This is for the screening we do that. Even the CT scan has less side effects. For screening for the lung cancer, 1 CT scan for low dose CT equal to 20 X-rays, whereas a normal CT scan is equal to 100 chest X-rays, the radiation dose. But still, it is safer in some people when we suspect something more serious. So how to prevent lung cancer? The first important thing is quit smoking. This is the first treatable cause of lung cancer. So if you stop smoking, there will be good reversibility and everything improves drastically. And avoid giving second-hand exposure to your family members. This is a second important thing. And certain exposure to radon gases that comes from the soil to the houses and all those things. But we don't have the equipment to measure how much is the radon gas in your houses and all those things. But still, that also one of the risk factors. And avoid junk food. That is also very important. And try to consume vitamin C rich foods. There's good data that shows that vitamin C rich food have lung detox properties among the smokers and even with normal individuals. We always tell them any citrus fruits which has more vitamin C is once in a day is better than taking one apple. And especially tomatoes in smokers, it helps a lot in preventing lung and prostate cancers because of the chemical lycopene. There's strong data on that suggests it helps. And how we treat the lung cancer? Somebody who gets lung cancer in the stage 1, if they come early, we go for surgery. Depends on the area that involved, we can remove the part of that area. And then comes the chemotherapy. If the stage 2 and stage 3, we go for chemotherapy that has their own side effects and also benefits also. Nowadays treatment is good, but still it depends on how early they go to the hospital. And concomitant radiotherapy with the chemo also helps them in controlling the disease. In stage 4 disease, we don't do anything. We give just supportive care that we call palliative care that goes in stage 4. Now let's discuss about the main culprit of lung cancer is the smoking tobacco. Tobacco smoking accounts for a lot of cancers also, not only for the lung cancer. 30% of all cancer-related deaths are because of the smoking. And the smoking cigarette contains the tar also, which is having almost 43 carcinogens. And the cancer risk increases 9-fold, of oral cancers increase 9-fold from the smoking tobacco, and throat cancers also from 9 times compared to the non-smokers. And esophagus, the pipe for the food pipe we call that also risk for cancer is 75% we see in smokers. And bladder cancer we see a lot among the smokers. Always remember, it's not the lung that is getting involved. All over the body, that carcinogens goes in the body. So not only lung cancer will be seen, all over the body, there are high chance of getting affected. Kidney cancers, pancreas and stomach cancer, everywhere there are high risk compared to the non-smokers. And as many of you know, first-hand smoke. First-hand smoke means the person who smokes cigarette, he is inhaling the cigarette, so he's the first-hand smoker. Second-hand smoke also, most of the people knows that the people surrounding you getting exposed is second-hand smoke. But third-hand smoke, it has come very recently, which shows that when somebody smokes in the house, when there is no family members around, or somebody smokes in the car when nobody is around also, still the curtains, the carpet, the sofa, everything will absorb the chemicals and it will release. That is we call third-hand smoke. There is a good data that suggests that even third-hand smoking also damages the people who stay in the houses. If you have gone to a hotel or if you have gone to a person with the smoking room, you can feel the smell is different when you enter the room. The same thing happens here also. The carpets, the sofa, the wall, everything releases certain chemicals that is very dangerous for the kids also. So always think seriously when you do smoking. Always remember, whatever you do in your 20s, 30s, 40s, you have to pay back. Even sugar, it goes whatever you eat, whatever you put in your body, everything you have to answer when you go to 50s and 60s, when you are in retirement phase. At that time, when you really want to enjoy your life with your grandchildren, at that time, it will affect badly. So be serious with your life. We have one life. So utilize it properly. I think many of people have cars and nobody takes stones and hit their car. But we are hitting our body. God has given us one vehicle to use it till 70 years. This is our vehicle. Use it carefully. Whatever you do on this body, you have to face it back because there is not much repair and servicing on your body. Okay, be careful in what you do. And shisha smoking, a lot of people think shisha smoking is more safer compared to cigarette. But this is also equally dangerous. We see a lot of females also smoke shisha thinking that it's less harmful compared to that. But smoking shisha will make first-hand smoke, second-hand smoke, and they smoke in the house. That will give them the third-hand smoke exposure to other people also. And smoking shisha is more harmful than cigarettes. 1 hour of shisha smoking is equal to 100 cigarettes. The tobacco consumption is significantly high. And it contains 15 times more carbon monoxide in that chemicals and 30 times more tar. In the cigarettes, tar is the thing that is more dangerous, that has more carcinogens. So this is also equally dangerous for the people. And sharing the pipe with other people will spread the infections like flu, COVID. At the COVID time, we used to tell that it spreads COVID also badly, and certain herpes of the lips and other things also. So smoking shisha is more worse than smoking cigarette, because you will be inhaling almost tune of 2 liters to 3 liters of the air, the smoke into the lungs, compared to only 500 ml of the air that goes through cigarette. Okay, so be careful with that. Nowadays we see a lot of young people, they switch to e-cigarettes, thinking that it is the most convenient, most safest one kind of thing. People with the smoking cigarettes, they die after, they have the complications after 20 years or 30 years or 40 years. Whereas e-cigarettes, we have seen within 10 days to months, the side effects affect so badly to the people, not for everyone. Some people, they get affected so badly that they need to go to the hospital with the complications with the e-cigarettes. The problem with the e-cigarettes or vaping is, first thing, there is no quantity of nicotine that you are going to take, because it's very easy. You can smoke wherever you like in the house, nobody, even in the office, in the washroom, wherever you like, you can smoke. For the cigarette, you have to go outside for smoking. And there is no control how much you are taking the nicotine. In the cigarettes, there is a count from the number of cigarettes. Whereas the vaping, there is no count. Once you put a liquid in that, you keep on smoking till the end. So like that, we have seen a lot of emergency calls in the evening times and night times in our hospital with palpitations. Because of high nicotine exposure, what happens is the heart beats faster. So this happens. People think that cigarette, I'm coming to a cigarette, a lot of people say that, why are you smoking? I have a lot of stress in the work. If you check your heart rate before smoking and after smoking, you are giving more stress to the body. Your heart rate will go by number 10 extra. So if your heart rate is 80 before smoking, after smoking it goes to 90 or 95. The heart beats faster because of the chemicals that you inhale. So it is not the stress buster, it is make you nicotine hungry, it crave, just your cravings will be handled, nothing apart from that. It will worsen your stress to the whole body. So it's not a stress buster, so be careful when you are smoking. The same thing happens because if you consume more nicotine, the heart rate jumps more. We have seen a lot of people, younger people coming to the hospital with increased heart rate like 120, 130, palpitations and all those things. And it will worsen the nicotine dependency, because nicotine is very addicted drug. So it will make more nicotine addiction, because the vaping you are doing uncontrolled. There is no control for the vaping, how many times you are inhaling that one. So that will worsen further. Only good thing about this is people switch to this for quitting cigarettes. Compared to cigarettes, it is slightly better, not for everyone. It's like somebody hitting their face with stone is a smoking cigarette, whereas somebody hitting their face with a golden stone is like a vaping. Both are harmful to the body. So be careful in what you do. And certain chemicals that have the vapors that are flavors, which are very dangerous, that will cause a lot of allergic reactions. And certain times the devices explode when you keep in a pocket, that will cause some harmful things also. This is the data we got as addictive substance. Nicotine on milligram and milligram basis 10 times more potent than the heroin, the narcotic drug that we get outside. 10 times more potent than heroin. That much addiction will be there with the nicotine. That's why it's very difficult to quit smoking. It's not that easy job. But still, don't touch nicotine. Don't go near to the cigarette. Everybody should enjoy. I also smoked in my life, in my college days. But you should be knowing when to quit. I smoked for 5 to 7 years. After that, I stopped it. It was very difficult for me to quit smoking. But this is the time, if you quit smoking in your 30s, mostly 90% there won't be any side effects. But if you keep on continuing the same thing, the more years you smoke, the more addiction will be more and more difficult to quit, and also the future will be more horrible. So always remember what you do in your 20s, 30s, 40s. I'm repeating this again and again because I see a lot of elderly people in our ICUs. They come to ICU with heart attacks and they stop smoking at the time. We tell them what is, so they say, from tomorrow I am not going to touch a cigarette. What is the use of quitting smoking when already there is a damage happened? When already somebody gets heart attack, means the heart got involved, means the pipes got blocked, the lungs also equally damaged, and other organs also equally damaged. When there are already harm done, there is no point in quitting when you are already unhealthy or sick. You would have done the step, taken the step 10 years before, then the life would have been different by now. So this is one of the most dangerous thing we see with the vaping. We call vaping associated lung injury or VALI or EVALI. e-cigarette because of certain chemicals in the e-cigarette we call tetrahydrocannabinol that has make like a pneumonia in the lungs for a lot of people and needs to emergency admission to the ICU leading to hospitalization. This is one lady I think you can see in social media that she was hospitalized because of the vaping associated lung injury. She got a pneumonia and she was ventilated. There was a tube in the mouth. She was hospitalized, almost she went to the death and came back. So she started this no vaping campaign. She tried something from her side also because it is very dangerous in younger age only. Within months, within days, within years it will affect. Smoking cigarette will affect you 20 years or 30 years later. But vaping we have seen lot of side effects, lot of asthma attacks I have seen with vaping because of once they change the flavor, certain flavors are not suitable to their lungs. It will cause hypersensitive pneumonitis also because of the vaping. That needs lot of cortisone and the final treatment is lung transplantation for those patients. So it's very dangerous exposure to vaping also. Let's go, if somebody decide to quit smoking, what are the benefits of smoking cessation? Beneficial starts at any age. Even if you quit smoking in your 60s also, something is better than nothing kind of thing, but already the damage would have happened. So think seriously, quit when you are healthy. And second thing, you people, for it is haram definitely. When you are having other occupational exposure of the chemicals, like people who works in oil and gas, for you smoking is strictly haram if you ask me frankly. Because already you are smoking in the workplace because of the chemicals and all those things. Already so much of damage will happen. On top of that, this also will make you more worse. So be serious if you are having other occupational exposure and if you are smoking, it will affect you very badly. And within 2 days of quitting smoking, you can feel the taste of the food, you can feel the smell of your perfume. Or else just you wear the perfume, within 5 minutes you will not notice your perfume smell also because your receptors in the nerves, in the nose has gone off because of the heat from the cigarette thing. Even we see smokers get more infections, more COVID, more bad things because they don't have the protection in their noses. Because what happens when you smoke, the heat from the smoke goes into the nose, the micro hair like we call microcilia that get bald completely in the nose. That is the protection that holds the bacteria and virus and dust particles when it enters into the nose, not the visible hair. Microscopic hair will be there. So those will become bald for the smokers. That is the reason the virus enters faster into the lungs. Once it goes to lungs, it is like a fertile field for the bacteria and viruses to grow in the smoker's lung compared to non-smoker's lung. So smokers get badly affected any infection, even COVID, simple influenza, whatever it is. And the lung functions improves by 30% in 2 to 3 weeks of quitting smoking, and risk of heart diseases reduced by half after stopping smoking for 1 year. And after 10 years of stopping smoking, former smokers' risk for getting lung cancer, other lung diseases almost become equal to the non-smokers after 10 years of quitting. But it matters when you quit, at what age you quit and how many years of smoking you have done. And also it will save you a lot of money, and in the pregnant ladies there are a lot of benefits by quitting smoking. We see pregnant ladies are the only good people who quit smoking when they become pregnant. Other than that, most of the people it will be very difficult for quitting smoking. So this is a small questionnaire. How many people smoke here? Can you just raise your hands? Good. Very few people. Okay, good. So think seriously. If somebody is really willing to quit and somebody who comes to our place to quit smoking, then we ask this basic questionnaire. Like how soon after you wake up you smoke your first cigarette? If somebody smokes within 5 minutes, within half an hour, within 1 hour or more than 1 hour. It all depends on the craving because the whole night your brain is fasting for the nicotine. If somebody is more addicted or more dependent on the nicotine, then they smoke within 5 to within half an hour of arousal in the morning because the brain is irritating them to smoke as soon as possible. So this is the important questionnaire for that. And second question we ask is, suppose you are in the flights for 4 hours, you feel irritated or you are comfortable, or if you stay for 4 hours in a meeting, you are comfortable staying 4 hours, you go out for smoking and come back. Or before the flight you take 2 cigarettes in the smoking room and then take your flight, or how you behave in the flight. All this questionnaire is important. And third one is, which cigarette do you hate to give up? Which is your favorite cigarette? After lunch or before breakfast or first thing in the morning? It all depends on that. The first thing in the morning is because they have more dependency. whole night they are not smoking. But we do see some patients, they wake up in the middle of night, they go out and smoke and then again come and sleep also. That much of dependency will be there for some people. And number of cigarettes does matter. And the first half of the day to the later half of the day also matters. Somebody who is having a lot of craving, they smoke in first half of the day, like from morning 6 o'clock to 3 o'clock compared to 3 o'clock to night. So that's why we suggest some of the organizations to ban smoking in their campuses. I see 2-3 patients who comes, they say, when I ask this question, they tell I smoke more in the night. Because in my work, they ban smoking. They don't allow us to smoke in the workplace because there's some pharmaceutical industry or something kind of thing. So if you ban smoking in your campuses, at least you can help them to quit smoking to cut down the number of cigarettes. And in certain countries like India, they strictly ban smoking near the public places, like near the schools, near the hospitals. There is no smoking zone there strictly. So if you do those kind of things, at least you can help them in quitting smoking. The last question that we ask patient is, if you get a flu-like symptoms, you still smoke the same number of cigarettes or not? If they reduce by 50%, that is good thing for them. That means that the dependency is not that. Based on this dependency score, we start whether they need simple counseling or they need some medication or say they need nicotine replacement therapy. For people with the 10 points or 8 points, we always add nicotine replacement therapy. This is like a certain pharmacological treatment we offer patients apart from the counseling. Counseling is the first thing, then second thing goes with the basic treatment, depends on the score of their nicotine dependency. For nicotine replacement therapy, we have patches, chewing gums, and sprays and inhalers. And there are 2 tablets that are available in the market right now to decrease the craving for them. Nicotine patch we use a lot in the hospitals for a lot of patients who come with the heart attacks and all those things. It's very safer. And it works for 24 hours. It will give, depends on the strength we use. If somebody smokes 20 cigarettes, we use 21 milli, 14 milli, or more than that, depends on the smoking history. That will decrease their craving when they are in the hospitals. This will help them in reducing the dependency. But this is still another form of, depends on the nicotine dependency. It is moving from one form of tobacco to another form of tobacco. This is also still not that advisable for all the patients. For whom dependency is less, we don't advise them to go with other form. In India, we see a lot of people, when we ask them to stop smoking, they go to chewing tobacco. There is chewing tobacco, they are comfortable doing that one. That also dangerous. Second option is chewing gums. This also helps. This is a little easier because that patch is 24 hours. This like a 2 mg, 4 mg, 2 strengths will be there. You can use it whenever you have uncontrollable craving. If somebody gets that I get irritated in the work, I get angry, then I need smoking. So instead of smoking, we tell them to at least take a chewing gum for a while so that the nicotine craving will be taken care of. Then the lozenges is also similar. This is the medicine that we use a lot in our hospital for patients who are planning to go for any surgery. Even if you are planning to go, somebody is planning to go for any surgery, like with a bunge, total bunge or anesthesia, it is always safer to stop temporarily at least for 15 days before surgery. That has a good outcome in post-operative management of the patient, because chronic smokers, they have bad outcome after surgery because after putting the ventilator, once we remove, they have a lot of secretions, a lot of complications. So this is a bupropion, the medicine. This is the antidepressant, which will make them feel good always. And the good thing about this medicine is they don't have the, even if they smoke also, they don't get that feeling high of smoking. It's like their second consecutive or third consecutive cigarette. So they don't enjoy the cigarette much. And secondly, it will not decrease their craving of cigarette also. This is a very good one, and people won't gain weight after quitting smoking. Especially a lot of females, they don't stop smoking thinking that it will make me weight gain and all those things. But this will make the weight normal. This will not not worsen their weight gain. Only side effects is it is contraindicated in patients who is having seizure-like activity, fits. There we don't use this one. Otherwise, it's very safe medicine. There are certain tips how to quit smoking. Somebody who really wants to quit smoking, first they should start hating the cigarette. Unless until you hate the cigarette, you will not quit smoking. So always start hating the cigarette. And keep a reminder in your mobile that I had to reduce my cigarette. Early morning, 6 o'clock, as soon as you put an alarm to wake up, write the message that I had to quit smoking, quit smoking. Daily, if you keep on seeing that, it will help you in quitting faster. And prepare a quit date. Keep one target. Without target, don't do those things. Keep a target 1 month. There are two ways of quitting smoking. One is abruptly quitting from tomorrow, I don't touch cigarette kind of thing, or making 1 month date. After 1 month, gradually, instead of smoking 20 cigarettes in a day, make it 18 next day. Gradually, each day, try to reduce 1 cigarette less. And go slowly and cut down the cigarettes. That will also is a good way of doing it. Somebody say that the smoking withdrawal effects will be there, nicotine withdrawal effects will be more. This compared to the risk versus benefit, if you calculate, the benefits are more in quitting than the whatever the small flu-like illness. People get cough, little worsening in the cough, because the body is trying to see that withdrawal symptoms. The nicotine is going away in your body, so the body is trying to adjust to the new environment. That is the reason people do get some cough, feverish feeling and flu-like symptoms, but it is also very mild only compared to what you do in the smoking. Tell all your colleagues that I'm quitting smoking by next week. Put in your social media as a status that I'm going to quit, so that everybody around you knows, so that they will help you also. Main thing that we see in a lot of offices is, if somebody is not willing to go also, the friends will take him out for the smoking. And with the coffee, they go out for smoking every 2 hours or every 4 hours. Like that they develop this habit of smoking. You have to try to cut down this group smoking kind of thing. And third thing, first throw away all your cigarettes and ashtray and the lighter and everything if you really think seriously about quitting smoking. Cut down each day one cigarette, and within a month you can stop completely smoking without any irritation, without getting any withdrawal side effects. This is the age to quit smoking. Don't prolong it longer. It will affect you badly in the future. And try to avoid the triggers. That is very important. Certain people, when they go to party, like in the weekends, they go to bars or discos, and there they try to smoke a lot. So try to avoid those parties. Try to avoid the areas where you go to smoke. Try to take a sick leave for a 1 week. See, taking 1 week sick leave, if you are really willing to quit smoking, is good enough than going to the workplace and daily getting irritated that I am with the friends I see and I go to smoke kind of thing. So try to quit, plan properly and quit smoking. That helps a lot. It will save you a lot of money. You will become more richer and more healthier also. Do some basic physical activity. That also helps a lot in controlling smoking, because that will give them diversion of the mind, and the stress levels also will be much lesser if you do that early. So May 31st, we observe World No Tobacco Day. All form of tobacco and those things. See, these are the lungs that you see, are the cancer lungs in a form. Don't let tobacco take your breath away. See, whatever we do, repeating again and again, whatever you do in your 20s, 30s, 40s and 50s, even uncontrolled sugars. I see a lot of patients, the sugars will be 300, 350, 400 in their 40s. They have to face in 60s or 55s. So even the cigarette also, if they smoke in their younger age, they work in the polluted area without wearing the personal protective equipment. I see a lot of young people in India, we go to a lot of industries, people, they think that's the hero. If you wear mask, they think that is somebody's weaker guy, he wear mask kind of thing. They get exposed to these pollutants at their younger age, and during the retirement time, they will cry a lot. So always in whatever you do in your 50s, how you live in your 50s, you will enjoy your life in your retirement, 60s, 70s and 80s. So be careful in what you do now. The best time to quit smoking is the day you started your first cigarette, and the second best time is now. Think seriously about quitting smoking and reform yourself and live a healthy, happy life. We have only one life. There is no rebirth and other things. So try to utilize it properly this lifetime. We have a good smoking cessation program in our hospital with the counseling from the psychiatrist and me. Both will be taking care of that. So somebody really serious in quitting smoking, if they are unable to do on their own, we are there to help you people. Please come. Think seriously about quitting smoking.